Okay, so next, for the chest examination, common nga po nga chest examination. So for chest PA, sometimes there are findings that needs confirmation, especially the chest areas, the lungs is covered with the bony structures, diba na yung mga puti-puti structures, and then the most common nga pathology is the TB. So na yung mga puti-puti nga bukog, na puti nga itong pathology, so sometimes magkuhan sila, magtabon. So sometimes one of the examinations that will be required is the apicolordotic view. So for the apicolordotic view, you can use an 11 by 14 cassette to be safe. Then of course, in order for us to protect the patient from overexposure, the required is 10 by 12 cassette. Where is it? Itanong mo sa. So 10 by 12 nga cassette. Tapos ang ato ang examination is an apicolordotic view. That means that is an AP axial projection, naka-AP si patient. This is my right side. This is the right side of the cassette. So dapat tingnan na ang ihang position pag sulod na ko diri sa cassette. Right side. Ano siya? So the size of the cassette, this is the center of our cassette. Asa siya taman, almost at the 14. The line before the 14. Kaya siya diha. Tapos iyahang top to bottom. Na. That means this is the only area that will be exposed to radiation. And if you have a patient, so muna po na siya na area na exposed sa outside. So for the apicolordotic view, baka tong you have to ask the patient to stand in front of the chest stand. Ano siya? With his or her back against the baki. Ano siya? Then ask the patient, so kung magpa-apicolordotic gani mo, as much as possible, ipahubo si patient sa iyahang shoes or sa iyahang slipper. Kay, diba, kung kabanta mo sa itong mga exercise facilities, naka-tiles. So, if naka-shoes si patient, naka-slipper si patient, basig maligyas. Ipa-forward mo sa patient, tapos naka-tilt ang iyang body, so basig ma-slide si patient, yun yung ma-hold ang iyang position. As much as possible, again, ipahubo na ito sa iyang shoes. Okay? So, for the apicolordotic view, patindog si patient, stand straight, and then take one step forward. So, one step forward atong patient, and then ask the patient kung sa Bisaya pa ipabian na to patient. So tilt the body of the patient, and then ask the patient nga ang likod sa iyang liog should be placed in contact with the IR. So at the same time, ang liog niya placed in contact with the chest baki. So ang shoulder po sa niya is naka-place in contact dito. Okay. Okay. So, sa libro, di ba, dapat nakaana si patient, nakahawid sa iyang ulo. But then, because medyo slide ang natuang chest baki, in the clinical setting, dili nato siya ginapaana, kaya medyo delikado. So, munang gabuhaton ni mong pili ka, gahawid siya direct sa atuang chest stand. The problem karon is dili na nato makuha ang iyang lungs. taas kayong IR. Dili na to pwede paubos ang chestan kay nakahawig si patient. Kung imo na ipaubos na ma-slide kayo si patient, ana. Okay, so what to do? Diba, kapag na pwede natin siya adjustan. So, the top portion sa atong cassette should be at the level of our C7. Muna siya ang edge niya. So, pwede gihapon, malibog mo sa yung C7, then the top of the shoulder. So, top of the shoulder, and then, kani siya is approximately nasa ikapon sa patient. Diba? Haway na siya na positioning. Ayan siya. Okay. So, kung dili kayo makabiad atong mga patient, forward. Kung dili kayo makabiad atong patient, kung dili kayo mo makuha ang apicolordotic nga view for a certain type of patient, kasi dili kayo sa makabiad, then katong naa sa yung positioning book by the theory, you can angulate the central ray sa palate, no, towards the head of the patient. Of course, I need to adjust. Mo pa siyang inaog. Dili nga imo lang isipalad pero wala nimo siya ginaog, so wala pulos imuhang sipalad angulation. For example, gisipalad nimo nakaana, sakto lagi mo angulation, naka 15 degrees, pero yung mga target is na sa ulo. Diba? Walay pulos yung mga examination. So, paubos yung mga X-ray tube so that the central ray should be directed same gihapon sa at the level of the T7 yung entrance. So, kapag ganina, perpendicular itong central ray, ito yung paubos ng cassette. This time, since ato mong gi-angulate ato ang central ray, ato siya ibalik pa sa ata. Take note, wala gi-adjust ang collimation, wala gi-adjust ang distance, ato lang gi-adjust ang angulation. So, kabantay mo sa sa iyahang collimation, naragihapon sa top of the IR. So that means the structures, instead of being projected perpendicular, they are projected towards a superior magod nga portion. So that's why isaka na to balik ato ang cassette. So right side of the patient, right side of the cassette. So same lang gihapon, diba? We always follow the rules. Right side gihapon ni ang ato ang ID mark. Okay. So question, if ever common questions ninyo, no? If trauma ang patient, laban na po sa inyong mga clinical setups karon, clinical rotation. What if trauma ang patient? Pwede ba siya i-chest PA? Okay. So depends on the trauma na, kung trauma like stab wound, so pwede mag-chest PA as long as wala ang kutsilyo sa atubangan, and then the instruction would be different. No, dili siya ipaginhawa og lawom. Okay, that would result to more injuries to the patient. And if the patient, ang trauma is a vehicular accident, gisumbag, tapos ang injury, isang target natin, isang ribs niya, kaya siya, that is a different type of examination, dili na chest PA. But then in the clinical setting, sometimes manggod ang mga doctor is not very familiar with our examinations. Ang ilang gina-request is chest PA, but then rule out fracture of the ribs. So do not do the chest PA examination, and no need to call the attention of the physician, but rather do the examination in an AP projection. So again, ribs nga trauma, dere, kani yung mga ribs dere, kung naa gani trauma ana, nabanggaan, sumbag, dibudalan, iyahang thoracic cage, you have to do the AP projection. Bahala pag PA yung gibutang sa sa physician's request. No? Again, some of the physicians labaw na kanang gikan sa mga small nga municipalities. For example, gikan sila ito sa mga bukid-bukid, tapos mga nurses na naghatag sa request, tapos nag-request is just PA, pero rule out fracture kay based on the history of the patient. For example, yung si patient nga na-disgrasya ko, tapos galiso ginahawa kay sakit ang dunghan, so possibility basing na na fracture nga rib. So do not do the chest PA, instead you need to do the chest AP. Okay, so for the chest AP nga examination, kung trauma atong patient, you can do the upright na positioning, but then the basic nga routine niya is to have the patient lie down. May pahigda nato si patient for the rib examination, okay, or for the thoracic cage. Okay. So lahi ang chest AP nga for the thoracic contents. The thoracic contents is the lungs, the heart, and then lahi pod sad ang sa thoracic cage nga AP. Thoracic cage nga AP, that means for the ribs and also sa iyahang vertebral column. So what to do if ever sa table ta mag-examine? Okay. So the X-ray tube should be placed perpendicular towards the baki na to. Okay. The table baki, but they are already perpendicular na sila like. Tapos ito ganina, siya, diba, that was the 72 SID, 72 inches SID towards the chest stand. So this time, as sa man karon ang ato ang table baki nga distancing, sorry na sa iyo. Siya, diba, this the 72 SID towards the chest stand. Siya, dire, kita ba? Siya. That is for the 40. Okay? So, ang 72 na to nga SID is only used twice. No? Isa, very common, is sa ato ang chest PA ng examination. And then, the other one nga 72 is sa ato ang lateral of the neck. Lateral of the cervical bodies. Okay, that is 40. SID. Source towards the receptor nato, which will be placed dire sa to ang baki. Okay, 40. That is 40 SID. So, bahala pag dili na ni siya musiga. Kani sa 72. That's okay. Okay, we are not dealing with the chest stand already. Kani siya, for this type of machine, again, you have to be very familiar with your tube, with your equipment. Kani siya would signify that the tube is at the center sa ato ang table. Kabantay mo sa atong table, that may center sa atong baki, kibali kani siya. Okay? So ato ang table can be moved. Pwede siya padulong dito, padulong padulong dito, padulong towards the chest stand. Siya, pwede siya move, and then towards the console. So question, how do we adjust the size of the cassette? The center of the cassette, nga wala man tayo nga ni. Wala ni siya sa table baki, di ba? Wala ni siya sa x-ray table nato, wala yung mga linya. Okay? So, that's the purpose for this light. So, that means kung musiga na siya, ang atoang tube is at the center already of the center of the baki. Or the IR, kung ato na siyang ipansak dire. Okay, so that is already at the center niya. Okay. So, katong kibali ito yung vertical na portion. So, that's the purpose. Purpose niya. Okay. So, kung imo na siya i-move, mapalong na siya. So that means nag-misalign na sila. That causes misalignment. Siga siya balik. Yun siya forward padulong dire. So nawala na po diyang alignment. Balik. Yan siya. So 40 SID, center na siya sa ato ang IR. So ato na lang movement kung naata sa ato ang table is this one. Pasaka dire. Siya. Sorry. Movement towards ito. And then towards this side.
So we have movement, inclination required is for the head. Siya. Pero nasangit naman, atong collimation is nara sa chest area ni patient. Tapos ang imong x-ray tube nga assembly is dili na siya pwede direct towards dito nga side. So what to do? Just move the table. Siya. Tatong head. So diba na tunong may hapon sa examination. Okay. So we are dealing with the chest. Ihapos yung mga chest niya dito. Kita ang coordination. Okay, so make sure that you provide privacy for the patient by providing as simple as a blanket. Wala blanket, then patient is calm. Okay, so chest area ng patient. Again, center na siya sa ito ang IR. Tapos mag-insert og 14 by 17. Ano kasi? For the chest AP, the most common nilang pangalan ani sa clinic or sa hospital setting, clinical setting is the chest Baki. Okay, chest Baki gani is different from chest AP. Chest AP is for the thoracic contents, katong opposite lang ni PA. To check kung nabay problem sa lungs, sa heart. Kung chest Baki gani yung nilang i-mention, that means that is for the thoracic cage, for the ribs, for the thoracic spine. Okay? So ang gagamiton nga cassette is a 14 by 17. As ang right side ni patient, ito ang right side ni patient dito the pitting side. So kung ato na siyang ipahigda, the right side sa ito ang cassette, sa the right side of the patient. Okay. So kanipod si Baki, ito na sa previous na akong video, pwede siya i-move, di ba? Siya. Tap sa shoulder ni patient. Na siya. At approximately at the level putsad. Approximately 2 inches above ana isang yahang C7. So dapat ang edge sa ito ang IR should also be approximately at that level. Nasa C7. Okay, we are dealing with the thoracic cage. Dapat makita si thoracic vertebrae. So dapat si thoracic vertebrae makita po sa niyang silingan adjacent structures. That is C7 sa taas. Nakatulog na itong patient. Oh, ako na-adjust ang collimation ako. Lingkod sa... Na-adjust ang collimation, yan ang tanawan sa iyo. So, you can decollimate, open tanan. So, open tanan ng collimation. Dili siya full blast. Yun, considered as full blast, kinalaman kasi mukhang full na opening of the shutter. Pero, that is required for the 40 SID, especially using 14 by 17. So, as you can observe, the centers atong central lay, wala sa center sa atong patient, no? Pero, kani siya, kaya nisiga naman to ganina, kani. That means, kung insert nato siya, center niya, ang iyahang, kani, the vertical niya ng center, kibali, is already at the center sa ito ang tube. So, what to do? Instead of moving the patient, again, atong table is movable. So, move the table until such time that the patient's MSP, MSP yung mention ganyan.
MSP dito.
MCP, ito sa lateral. MCP, maganda sa lateral.
MCP. Nagkurang na ito.
Ang MSP ko. So the center, the MSP of the patient is also at the center sa to ang central ray kani siya. The vertical niya nga portion. So question kani isa, asa man siya dapat nga level? So asa man in between sa atong T1 up until the T1 to T12. So narag hapon siya kan T number 7. So for the IR this time, nakato sa ato ang previous nga video. Remember the previous video? Kani bangag dire nga gamay na ay light nga gagawas dire. Kani siya. Kani siya nga light is mo niya makita dire. Kani siya. So that means kani siya nga linya, katong horizontal niya nga linya is also in line with this light. Okay. So dili na nako mamove ang ako ang ako ang IR pasaka siya. So what to do for this type of problem? So again, move the patient. Na ato i-move si patient padalong dito so that the top is also at the level of C7. Siya, top niya C7. Tapos the vertical niya is at the MSP of the patient. Then move. So that the center wait siya doon collimator na sa tanong na. So the center kabantay man medyo na triangle gamay dire. Yeah, that's the center of the 14/17. So that means ang center sa atong tube is at the center sa atong IR. And then kani siya, yung vertical nga line is at the center gihapon dito sa atong IR pagpasulak nato. So again, you have to same dito sa atong chest baki. You have to lock it in place. Kani, this is the release. This is to lock. Again, katong nay duha ka buok diba nga clip niya in order to lock it in place. And then adjust the position of the patient and also the collimation pagsad. So nagya po border approximately 1 to 2 inches gyapon nga border niya kabantay mo na top of the shoulder ni patient nakita pa nga naay nitipas nga collimation. Siya. So that means dili ka ma-cut off ana sa imong T1. Okay, breathing instruction for a chest AP baki. Chest AP for the thoracic cage is you have to simply ask the patient to hold his or her breath. Okay, so kung dili po sa atong control console, again, this is the chest baki. And then this one will indicate that we will be using the table baki. And then what type of examination. And then the set of factors. Okay, so pwede gyapon siya adjustan depende sa inyong examination. Depende sa body habitus again sa itong patient. So both can be adjusted. The MAS and also the KVP setting can be adjusted. So this time, if ever candy atong gi-activate, then that means if ever mag-expose ta karon, yes sir, then that means the table baki will move. Okay, again, the baki would refer to the grid. But the baki, the grid. The most common term is baki, taban sa mga hospital kay. For example, siya, baki tray, the chest baki. Baki usually nila have terminology instead of using the word grid. But that's actually just the same.
Okay. Next, for the chest examination, if ever the patient has been confirmed with having pleural effusion, that means na ay tubig ihang baga. Okay, so sometimes the radiologist or the attending physician would require a decubitus positioning for the pleural effusion or patients with pleural effusion. So by the term itself, decubitus, that means we need to have the central ray directed horizontally. Okay? So, if the patient's condition, for example, pleural effusion siya, tapos niyang the affected side niya is the left lung, is my left side. If the affected side is the left lung, then the position of the patient would be a left lateral decubitus. If the affected side is the right lung, then right lateral decubitus. Okay? So kato ganina, like for example, kato nakalingkod atong patient sa wheelchair, so same ang gihapon ng buhaton sa X-ray tube. So some facilities, some X-ray facilities, they have ceiling-mounted nga mga X-ray tube. This is a wall-mounted or floor-mounted nga tawag ni nga assembly for our X-ray tube, di ba? In rad physics, na-mention to nga na ay ceiling-mounted nga mga X-ray tubes. So there are actually ceiling-mounted X-ray tubes here in CDO, nasa COMC. Okay, so if ceiling-mounted, then we can position the tube towards this side. Pero if with this type of X-ray tube that is wall-mounted, so ingatan itong buhaton, same katong sa wheelchair. Okay, so the X-ray tube is cubic.
Ito yung cellphone. Ito ang
Tube.
no?
Cubic siya, that means video. Okay, so we have the X-ray tube directed horizontally. And if butang na to, the condition of the patient is na siya right-sided nga pleural effusion. So the position of the patient should be right lateral decubitus. Asal piti mong right side patient. Na siya, so dito ang right side sa patient, so dito mo atubang si patient sa iyahang right side. Si ma'am, natilid ka pa doon sa imuhang to. Oh, okay. Yes, of course, you need to provide privacy. Yes, siya. So, in the clinical setting, they usually have a foam wedge nga patungan ni patient. Kay, like for example, in this case, nga wala tayo foam wedge karon nga gigamit for the sake of demonstration. There is no distance between the table and then the patient. So if atong i-expose si patient karon, most of the X-rays will be absorbed by the table, and the side of the patient that is closest to the IR is the affected side. So dili siya or closest to the table, dili kay siya clearly demonstrate. So that's why dapat na siya foam wedge diha. Okay? So for the IR, as sa ibot ang IR, dito atong X-ray tube. So dapat opposite sa atong X-ray tube ang placement ni IR. Forward. Forward na. Okay. So again, it is important nga na foam wedge, at least mga 5 inches ng foam wedge in which the torso of the patient will be elevated. Okay, and then you have the IR again. X-ray tube, opposite niya will be DIR. So yung relationship should be same lang gihapon kung may chest A theta. Yeah. They are still perpendicular. Okay. So to hold that in place, you can use sandbags, or in this case, wala sandbags, but then there are these water jugs no used for na nakasulat cervical weight bearing. Okay. Saan na? Okay, so, di ba, if there is no foam wedge between the table and then also the patient, so the edge of the patient is naapot sa dire, na side. So that means some of the structures will be cut off. So it will not be displayed sa radiograph. So that's why it is important that there's a foam wedge. If there's no foam wedge, then I can use a lot of books or maybe pillows. Okay, so like for example, elevator to patient, then just simply adjust the X-ray tube. Okay. Collimate to the structures of interest. In which the target is the thoracic area of the patient. So included in yung superior portion, and then also the inferior portion, which can be collimated. No? Pwede ba siya po? Come yan. Okay, so dili naman move, so we'll move the table. So again, the affected side is the side that will be placed closest towards the table. Okay. So the purpose for this, the decubitus is for, and also the upright, especially for pleural effusion, is to demonstrate the air fluid level. If the patient, that for the upright na positioning, if the patient has been lying down for some time, then you have to allow the patient to sit up or to sit down for approximately 15 to 20 minutes before you take the upright exposure. And if the patient has been standing up or in the sitting up na position, then magkuha ta dayon niya ni decubitus na positioning, in which ato siya position towards the right side lateral or the left side nga lateral based on the condition of the patient, which side is affected. And same lang gihapon na. You have to give at least 15 to 20 minutes na allowance in order for the fluid to go down and then air to go up. So that is the air fluid leveling. Okay, chest examination. Question, what if pediatric ang patient? So if pedi ang patient, depends on the height and then the body of the patient. So if
Ampan.
so for the basic protocol, for the adult, it is common nga chest PA lang, but then for the pediatric patients 12 years old and below, we usually do the PA and lateral. So you can do the PA using a 10 by 12, and then the lateral using an 8 by 10 cassette. And if the patient is tall, then you can use the 11 by 14 for the PA, and then also 10 by 12 for the lateral. Okay. So if the patient is a newborn, you have a newborn patient dealing with conventional radiography, we can use the 8x10 cassette. Okay, for PA and then, not PA, but AP and then lateral. Okay, so newborn ha, pwede ipakulog ang patient, ipahayang na si patient, ipahigda na siya sa cassette. In computer and digital radiography, since most commonly they only have one size, the 14x17, so they can do the AP projection on this side and then the lateral projection on this side. So depends on the protocol of the hospital. Sometimes they only do one projection per imaging plate. Okay, especially in DR, only one projection per plate because that will be directly converted into an image. But then they would just, even if the cassette is very large, for example 14x17, but then the collimation is only towards the area of interest. Okay. So some pediatric patients, especially if 5 years old below pa sila, they cannot stand on the chest bucky or the chest stand by themselves. So if that would happen, then just have them lie down on the radiographic table. Okay, especially kung mga 5 years below, so they cannot stand on their own. So, and if sometimes they can stand, but then the problem is they cannot do the PA projection because maghangad silang ayok. Their chin will be raised and then it will be uncomfortable for them. Sometimes matumbas sila pa talikuran. So if nga naman ito just have them stand up and then face towards the X-ray tube, and then same maghihapon ang iyang position. You can have the patient do like this if the pediatric patient would understand or can follow the instructions. Okay, and if the patient will not cooperate, then just have the patient do like this, or maybe just the hands should be placed on the side. But as much as possible, pwede po siya isaka. Okay, so you can have one of the family members of the patient to hold the hand of the patient pasaka. But similar since we are in Philippines, very rare nga na ay pig-o-stat diri nga. Remember the pig-o-stat katong device in which it holds the pediatric patients during the chest examination. So wala kayo siya diri. Ang kabuhaton is have the family members hold the patient during the examination. Okay, so ipataas lang ang kamot. Okay, so if punta na to, your patient is pediatric, 5 years old below, tapos the companion niya is his or her mother, and then the mother is pregnant. So what to do? You can call an orderly from the hospital or the wardman sa hospital. The orderly or wardman is just the same as the terminologies na ang get-refer. Okay? So in that case, pregnant ang mother sa patient, no other companion, then the next na person that can hold the patient should be the orderly, not the radtech. Okay? So last resort na kita as much as possible.